Welcome to the session on Assessment of Public Health Risk. Hi, my name is Rajesh Pai. I work with WASH Institute. In this session, we will learn about the risk-based approach to planning for town sanitation, understand the process of identifying potential risk, and explore the barriers that can be introduced to effectively address those identified risks. So, let us first look at what the objectives of the sanitation should be. The primary and core purpose of sanitation is to improve public health by reducing the prevalence of sanitation-related diseases through better waste management and hygiene practices. It also seeks to ensure environmental sustainability by promoting eco-friendly sanitation solutions that minimize environmental impact. Additionally, sanitation aims to enhance social equity by ensuring that all community members, especially the most vulnerable, have access to adequate sanitation facilities. Finally, it promotes economic benefits by reducing healthcare costs and improving productivity through a healthier population. Insufficient and ineffective sanitation systems or hazards at any stage enable the spread of disease-causing pathogens. The human host produces feces and urine, also known as excreta. This excreta finds its way through a toilet to various stages of sanitation chain like containment, conveyance or transportation, treatment, disposal or reuse. Unsafe handling of excreta at any of these stages can lead to a sanitation hazard. The pathogen transmission is possible through means like flies, animals, water bodies, fields or groundwater, and this possible transmission is known as a hazardous event. These pathogens can be exposed back to human beings through crops, drinking water, hands or fingers, feet or skin, and objects or surfaces. Once the humans are exposed to pathogens, they will enter the body through face, mouth, and feet, resulting in diseases. For example, if a household is connected to unsafe containment system like a pit latrine in a high ground water table area and households source drinking water from open wells nearby, then the pathogen transmission is very likely and can result in affecting human health. Risk is a product of exposure to hazardous events. Frequent exposure increases the risk. For example, if a household does not have a containment system and disposes its toilet waste in a pond and then uses the same water for drinking, the risk is considered very high. To address this risk, we need a structured approach. A risk-based approach is an approach suggested by WHO that helps improve public health by assessing the risk and build barriers to pathways where the used water may impact public health. To effectively manage the risk, let us go through the steps involved in the risk-based approach. The initial step involves identifying all potential paths in the town that pose risk to public health. Next is to quantify the exposure, such as determining how many households are dependent on a particular system in a ward. Then, categorize the risk as low, medium, or high. Finally, determine the barriers or solutions that should be implemented to address the risk in the identified paths. Let's explore the various risk categories to gain a better understanding. For instance, if the majority of households in a ward use pit latrines and depend on shallow groundwater sources like open well or hand pumps for drinking water, this would be designated as high risk. If only few residents use pit latrines but majority still depend on shallow groundwater, the classification would be medium risk. However, if few households use pits and most rely on deep tube wells for water, it would be labeled as low risk. Let us move ahead to learn more about possible scenarios, transmission paths, and the appropriate barriers to mitigate the respective risks. Firstly, let us map possible sources of water based on the household survey and interview with the local authority. They can be broadly classified into three categories. The surface water body such as river or a lake, groundwater from shallow aquifers and groundwater from deeper aquifers. Next, let's examine the possible ways for managing black and grey water in the town. Generally, used water can be either infiltrated into the ground or directed to the specific area. The black water can be managed in ways such as through a septic tank, where the effluent can be managed through a soak pit or can be conveyed to a disposal site through an open or closed drain. Alternatively, it can be managed through a pit latrine or twin pit latrine also. Another way is through a sewer network. Along with the grey water, it is conveyed to a designated area. While the grey water can be managed by conveying it to a designated area through an open or closed drains, sometimes along with septic tank effluent or by infiltrating it into the ground through a kitchen garden or soakaway. Next, we need to assess the groundwater level prevalent in the ward or town. Different soil have different resistance to flow of water through them before reaching to groundwater. This resistance helps in curbing and containing the pollution from directly reaching the water body. Various research indicates a safe distance between 3 to 6 meters from the bottom of the pit to such sources. So, we will consider the depth of 10 meters below ground level to be safe distance that helps in significantly preventing any groundwater contamination from discharge of used water in the soil. Hence, as a next step, we determine whether the groundwater level in the town is less or more than 10 meters below ground level. In both scenarios, it is essential to identify possible pathways that could lead to health hazards, as this will help in identifying and prioritizing the necessary interventions. We will examine each scenario individually. Let us examine the scenario 1, where the groundwater table is 0 to 10 meters below ground level. Sanitation systems that are infiltrating into the ground, such as twin pit or pit latrines, soak pits attached to the septic tank, and unlined open drains can pollute groundwater and pose a health hazard. Additionally, if untreated used water and fecal sludge are disposed into the water bodies or open areas, they can also pose a health hazard. Therefore, it is important to add barriers in all these pathways to improve citywide sanitation. All the hazards are shown through red-colored arrows in the diagram. If the groundwater table is high, there is a risk of pollution of shallow aquifers through various kinds of infiltration of used water. Discharging untreated used water into the water body also poses a risk of surface water pollution. Therefore, drawing an untreated water from open wells or shallow aquifers or surface water bodies for drinking purposes can pose a health hazard. We need to implement effective used water management practices to prevent health hazards from groundwater and surface water pollution. Here are the key steps. First, we need to ensure that all sanitation systems that release water into the ground are avoided. Next, all used water connected to the sewerage network should be sent to sewage treatment plants for proper treatment before its disposal or reuse. Regular desludging of septic tank is mandatory, and all fecal sludge should be transported and treated at a fecal sludge treatment plant or co-treated at the sewerage treatment facilities. All the used water flowing in the drains should be intercepted and diverted to the sewage treatment plant. Finally, convert all the unlined drains to the lined drains. All the identified barriers are shown in green colors arrow in the diagram. Having addressed used water management, it's equally important to consider measures for protecting the water supply. The potential hazards can be mitigated by installing barriers of water treatment plants and disinfection units. Household level disinfection units can also be introduced. As an immediate step, stop using water from shallow aquifers for drinking purposes. Now consider the scenario 2, where the groundwater table is more than 10 meters below ground level. The disposal of untreated used water and fecal sludge into water bodies or open spaces presents a significant health risk, and therefore it is essential to implement barriers in all these pathways to improve citywide sanitation. While the systems infiltrating into the ground do not pose much risk as the groundwater table is low. If the groundwater table is low, the chances of pollution through infiltrating systems are reduced. However, surface water may be contaminated, so using it for drinking purposes may pose a health hazard. To mitigate the risk associated with both low groundwater table and surface water contamination, here are the steps to manage used water safety. First and foremost, it is essential to ensure that all the toilets are either connected to on-site systems or sewerage network so that no black water is discharged directly into the environment. We can maintain the status quo for on-site systems that are infiltrating into the ground. Next, all the used water connected to the sewerage network must be directed to sewage treatment plants for proper treatment before it is disposed of or reused. It is important to enforce regular desludging of septic tanks. The fecal sludge should be transported and treated at a fecal sludge treatment plant or co-treated at the sewage treatment facility. Furthermore, all the used water flowing in the drains should be intercepted and diverted to sewage treatment plant. To address potential hazards in the water supply, we can include barriers of water treatment plant and disinfection units. We can also introduce disinfection units at a household level. Let us summarize all the barriers that should be implemented in each scenario. When the groundwater table is high, abandon all infiltrating systems by either ensuring that outlet of septic tanks is connected to line drains or households and other establishments are connected to the sewerage system, and convert all the unlined drains to lined drains. Strengthen piped water supply of treated water. But when the groundwater table is low, maintain the status quo for infiltrating systems like pits, soak pits and unlined drains, but ensure its proper maintenance. Then intercept and divert used water from unlined drains to sewage treatment plant. However, there are certain common barriers for both the scenarios, such as ensuring all the toilets are connected to either on-site systems or sewerage network so that no black water is discharged directly into the environment. Periodic desludging should be implemented and all the fecal sludge emptied should be co-treated at the sewage treatment facility or treated at a fecal sludge treatment plant. It is important to ensure that all the used water is conveyed to the treatment facility either through sewerage network or through interception of line drains. Ensure that all the used water gets treated to the desired standards at the treatment facilities before its end use or disposal. On the water supply side, no water should be used directly without treatment and disinfection. Before we conclude, let's summarize the key takeaways from this session. The core objective of sanitation is public health followed by environmental protection. Disease-causing pathogens can be transmitted to humans through various pathways due to inadequate and inefficient sanitation system at any stage of the sanitation chain. One of the main sanitation risks is the contamination of drinkable water through these pathways. The level of risk depends on exposure to sanitation hazards. Higher the exposure means higher risk. Using a risk-based approach can help in selecting the appropriate barriers or solutions to address the sanitation hazard. Thank you for going through this session.